Hello guys, Vanakkam and welcome to Meteor Nursing Academy. Firstly, I would like to wish you all very happy new year. So Meteor Academy is one of the leading academy in training nurses in their nursing competitive exam as well as IELTS and OET training. And in today's session, we are going to discuss in detail about JIPMER skill test examination. The full detailed explanation is going to be there. So how you have to prepare yourself mentally as well as physically, and how the setup is going to be during your examination, each and everything we are going to discuss. So listen to the video till the end and share the video as much as possible so that everyone will get utilized from this. So let's begin the session. And if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. So let's begin the session. Before starting the skill test, they will be asking for the document verification. It is very important thing to bring all the essential documents. So the first thing what you're supposed to have is application form. While you are applying for the exams, you would have been uploaded all your important details like name, age, sex, your clinical experience, you belongs to which community, that is whether OBC, SC, ST. So all those things, your signature would have been uploaded, your photos are uploaded, right? So everything will be there in the application form, and you might have been already downloaded it. You will be having that application form. So that application form you supposed to bring there. Why we need to bring the application form? They will be checking the genuinity of the certificates. Whatever you have mentioned in the application form, the same thing is there in the original certificate or not. That one they will check. That's why it is very much important. For example, you would have been mentioned OBC, then they will be checking for the OBC certificate. If you are mentioned SC ST, they will be checking for SC ST certificate. If you have mentioned 1 year or 2 year or 3 years of experience, they will be asking for that experience certificate. It will be like that. Okay, so don't worry about anything, just be cool, prepare yourself, have all the essential documents. That is more than enough for your preparation. Okay, so what are all the important document we supposed to have? The first thing is obviously registered nurse, that is RN RM certificate. Okay, this is the license, right? So please make sure that you are having a valid RN RM certificate, because nowadays you all know that registered nurse or registered midwife certificate, it will be expired, it is getting expired. You have to renew it by means of getting the CNE point, right? So make sure you are accomplishing all the CNE point and you are having the valid RN RM certificate. Okay, and the next one is degree certificate. So you would have been having the degree certificate, no issues on that. Experience certificate, valid experience certificate, underline the word, because if you are mentioning 2 years of experience and you are showing only 1 year of experience, means no use at all. Okay, so valid experience certificate has to be produced during the verification, because nowadays background verification is going on. So you have to submit the genuine experience certificate. The next one is community certificate. So like OBC, SC, ST. For SC, ST candidate, normally one certificate will be there, so no issues on that. They can bring that SC ST certificate. For OBC candidates, so they are making some mistakes and they are facing many problems. See, while you are applying for the exam, you should be having the valid OBC certificate while you are applying. What is the meaning of valid OBC certificate? One OBC certificate is valid for only 1 year. Only 1 year means only one financial year. It doesn't mean that if you are having the OBC certificate this December, till next December the OBC certificate is valid. It is not like that. It is a mistake. Okay, so one financial year in the sense from April 2022 till March 2023, that is called as one financial year. In that period, your OBC certificate is valid. If you are getting the OBC certificate on December 2022, and it will be valid for only March 2023. Okay, so March is the dead point. If you are buying the OBC certificate in March 1st 2023, means it will be valid up to March 30 2023 only. So don't get confused. See, OBC certificate means it is valid for 1 year. 1 year means from April to next year March. That's all. So while you are applying for the exam, your OBC certificate should be valid. While you are submitting the OBC certificate during the document verification, it should be valid. Don't submit the expired OBC certificate. Okay, because many students are making mistakes and many are getting rejected because of this reason. And other things like NOC, if you are currently working, especially in the government sectors, you supposed to have the NOC certificate. Before applying for the exam, you would have been already got the NOC certificate, no objection certificate. Please bring that no objection certificate without fail. Okay, so that your experience will be easily counted. And the last one is date of birth, proof for date of birth. So for this, either you can submit your birth certificate or 10th and 12th mark sheet. In that, the date of birth has to be mentioned. If it is mentioned, means you can submit that also. Okay. After the completion of document verification, you are allowed to enter inside the stations. There are 4 different types of stations. See, usually they will keep 4 stations. It might be 3 or it might be 5. It may increase or decrease. It depends upon the examiner's ideas. Okay, fine. Mostly they will go for what? 4 stations. So we are going to see an overall view about those stations in detail. So listen carefully. First, let's begin about the station 1. The station 1, mostly they will be arranging some instruments. Either it is a surgical instruments or even they can arrange some articles, and they will ask you to write the names, or else they will be keeping some or arrange some machines, tubings, otherwise some image based questions will be there. Okay, they will be giving some paper pencil. In that some images will be there, and they will be asking you to write the name of those images or procedure, whatever is there in the image. Otherwise, even they can keep some crash cards, models, IV fluids. Okay, so in detail we will be seeing about each and everything. The first thing is instruments. The instruments like surgical instruments, or they will keep some articles and they will be asking you to write the name of those instruments or the indication for that instrument. And second thing is machines. They will be keeping some machines like infusion pump, syringe pump, cardiac monitor, ventilator, DVT pump. It is also called as sequential compression device pump, which is used for prolonged bedridden patient. Dialysis machine, incubator, CPAP, BiPAP machine, defibrillator, crash cart, oxygen cylinder, warmer or thermostat, suction apparatus, hot lung machine, ECG machine, automated adjustable beds. So like that, they can keep the machines and they will be asking you to write the names. Sometimes even they can ask to write the indications of the instruments also. Okay, so let's move on to the next one. Very common thing you can see in the station 1 is tubings. First instruments, second machines, third is tubings. Examples of tubings are NG tube, and they will ask the size and indication, ET tube size indication, ventilator tubings, TPs, again CPAP, BiPAP tubings, different types of mask like non-rebreathable mask, rebreathable mask, Venturi mask, nasal cannula, and its flow rate and indication for these different types of mask. IV cannula size, color, gauze, indications, IV tubings like burette set, dial flow set, what is the drop factor for the burette set, dial flow set, clave connector, central line tubings, 3-way connector, T-tube, tracheostomy tube, arterial or CVP line, nebulization mask. Okay, so these are all some of the tubings. Okay, so other than this also, if you have some knowledge about the tubings, you can add or study about those things also. Fine. The next thing is, next common thing what you can see is crash cart or emergency trolley. In this, what they will ask? They will ask the color coding of the life-saving medications. And also they can ask about the look-alike medications, sound-alike medication, arrangement of medication in the crash cart. In which rack life-saving medication has to be arranged. In which rack look-alike medication has to be arranged. Sound-like medication has to be arranged. Where the defibrillator has to be arranged. What are all the color given for high-risk medication? What color coding given for high alert medication? Policy for nearby expiry medication. How to check the oxygen cylinder present in the crash cart? Where is the defibrillator shelf? Each rack of crash cart contain what? Crash cart register. So from here there is a chance for asking questions. And next one is other very common thing what you can see is IV fluids. They will be keeping the IV fluids bottle and they will be asking different questions like what type of fluid is this, whether it is a isotonic, hypertonic or hypotonic solution. Okay, and they will be keeping D5, D10 and D25, and they will be asking for managing which condition you will be using this fluids. For managing hypokalemia, what you will be doing? A solution used for managing dehydration, whether it is a RL or NS. Solution used for managing the DKA. What are all crystalloids? What are colloids? Can you give the examples of crystalloids and colloids? So these are all the way they can ask questions. Okay. So these are all the common things what they can keep in the station 1. After completing station 1, they will be giving some time for completing station 1, whether it is a 5 minutes or 10 minutes, whatever. And in that period, you have to complete the questions in the station 1. After that, you have to move to the station 2. Mostly in station 2, what we can expect is calculation. See, it is only expectations. It might be changed according to the idea of the examiner. So in station 2, mostly calculations will be there. What calculation? Drugs and fluid calculation. Let's see. Drug calculation for adult and pediatric. How to convert from milligram to microgram and from gram to milligram. What is the drug calculation for dobutamine or dopamine? Okay, these are all the special drugs. So special calculations are there. So IV fluids calculation like flow rate calculation. Burns fluid calculation like Parkland formula, Brooks formula, drop factors for adult and pediatric. So these are all the different type of questions you can expect in the station. Fine. Next, move on to the next station. Now we are going to see about the station 3. Here OSCE is going to be there. What is OSCE? Objective Structured Clinical Examination. Here the examiner is there and they are going to make you to do certain nursing procedure and they will be analyzing your performance, whether you are doing step by step, which one you are supposed to give the priority. For example, from arranging the articles till replacing the articles, each and every step they are going to monitor from you, okay, through OSCE method. So this is what going to happen in the station 3. Okay, so let's see what are all the common procedure they would have been asked till now and what are all the procedure we can expect they can ask. See, the first and foremost and important thing is hand washing. The techniques of hand washing, steps, duration of hand washing, types of hand washing, medical and surgical. Okay, so in every exam this is very important, guys. Okay, in all the procedure we supposed to do hand washing. Without hand washing we are not going to enter inside the procedure, right? So they are going to see the steps, duration and techniques. Hand rub, here also they are going to see the same thing. Administration of different types of injections, whether intradermal, subcutaneous, whatever it is. Okay, and IV cannulation, in which degree you have to insert the cannula. For adult, pediatric and for geriatric people, what is the size of the gauge, cannula gauge we supposed to use. While transfusing blood, which cannula you are going to use. So all those questions related to IV cannula they will be asking. Positioning, for each disease condition they will be asking the position. Okay, and IV fluids administration, techniques and steps. Next is stoma care. Usually you can do this stoma care in the dummies. Mannequin will be there and they will be asking you to do the procedure like stoma care. Insulin administration, site and technique. NG tube insertion, here also position and each and everything like articles arrangement. The techniques of insertion is these things. After inserting, how you are going to check whether it is in the correct placement, all those things they will be asking. Urinary catheterization, male and female, physical examination, BLS, dressing, Gangaru mother care, bed making technique, oral administration of medications, tray setup for each and every procedure. They will be giving certain name of the procedure and they will ask you to set up the tray.
sampling technique, that is phlebotomy, how you will insert the needle and withdraw the blood sample, suctioning like oral, nasal, tracheal, sponging, vital signs monitoring. So for that they will be asking you to arrange the tray setup, ECG lead placements, medication reconstitution, how to dilute the medication, how to load the medication, that is medication reconstitution, crutch walking, cane walking, pin side care, urine culture collection from urinary bag, tracheostomy care in mannequin, oral care. So these are all the common procedure you can expect from the examiner to do or perform from you. Okay, so prepare all these procedure very nicely and ask yourself the questions. For if I'm doing this procedure means which one should be the first and which one should be the last, how the step is going to be, and what are all the questions you can expect from the examiner. This is how you have to prepare yourself while you are doing the procedure. Okay, and the next thing is station 4. Here oral interview will be there, personal interview will be there. Here they will be asking the questions directly. The examiner and you both will be sitting in a separate station and they will be shooting the questions towards you and you supposed to answer. This is the very crucial point because you are going to sit along with the examiner. You should have full confidence. Don't worry about anything. Have adequate confidence and answer the question correctly. Okay, correctly giving the answer is very important because from your answer only they will be starting the next question. Okay, so be very cautious while you are answering. So first what they will be asking, they will be asking you to introduce yourself. So you have to introduce yourself and they will be asking about your previous year of experience, in which area you are experienced in, whether you are in medical ward, surgical ward, emergency, post-operative ward, cath lab, where you are having the experience. From there they can ask the question. Otherwise you would have been done the procedures in the previous station, right? So from that procedure they can ask the question. Okay, so as I mentioned already, examiner will ask questions from your answers only. So please answer correctly and confidently. Okay, everything you can solve it very easily. Don't worry about anything. Okay, be calm, in a relaxing mind. You have to do everything from station 1 till station 4. Everything do it very confidently. You can achieve it. Okay, so thank you, all the best for your skill test. Have confidence, work smart. If smart work doesn't matter, definitely hard work matters. Thank you guys. Once again, Happy New Year for one and all. Please follow us in Meteor Nursing Academy YouTube channel. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Share as much as possible. Support our channel so that you will be getting more and more updated videos.